Welcome everyone, and welcome to this first run of the RaCEEs course. It's really good to see many of you here today, and we're gonna spend a few minutes later on in terms of introductions. But first of all, just very happy to see many participants, and I'm really happy that you registered to the course, and thank you for that. And hopefully you will enjoy this course. Now I'm gonna share the slide for the first session. Here we go. I'm just gonna go on presentation mode. Can you all see the slides? Yeah, that's good. That's great. Thank you. As you know, we will make the slides available after the session. So we will share them on the TeamSpace. We will also, if you have problem accessing the TeamSpace, we can send them by email. So don't worry about that. And we will try to resolve any access problems with you. So I guess many of you have managed to access the TeamSpace and try to navigate it a bit, but I know some of you might have encountered some problems. So if you have any problems, just feel free to get in touch with me, and we will try to see how we can deal with that problems, with those problems. So what I would like to do now is just give you an introduction of me first of all, and then of course Cath, who is co-running this session with me today. So session 1 is about selecting an economic evaluation. I'm Valerio Benedetto. I'm part of the MIDAS team, and I'm a research fellow at UCLan. And I'm very grateful that today Cath is here with us today. And Cath, would you like to introduce yourself as well?
Hi, I'm Cath Harris. I'm an information specialist with the MIDAS team.
Oh, thank you, Cath. As I say, in a few minutes, I will let everybody introduce themselves, so we'll have the opportunity to know each other a bit better. But first of all, I just wanted to recap a bit what we're trying to do with this course. So this is the RaCEEs course, Rapid Conversion of Economic Evaluations. If you watch the webinar, which we run more than a month ago now, you will know what the objectives, the aims of the RaCEEs are, but I'm just gonna recap these aims here with you today. Essentially, we are trying to grow our skills in health economics and health economic evaluation across the economics course. So today we have people from member organization, public advisors, and the objective of the RaCEEs course is to grow the skills of health economics and health economic evaluation across the economics course. Practically, you will work in a team in order to critically appraise an economic evaluation. So each team will have an economic evaluation to work on, and together with the help of us, the team leads, you will be able to critically appraise the economic evaluation in order to inform change in policy and practice. So it's not just the case of doing a critical appraisal, but we want to really do something in terms of informing change in policy and practice, if it's possible. And third, you will have a final output at the end of the course, and you will have the opportunity to produce this output, which is a publishable commentary, a short commentary, which will be centered on interpretation of the economic evaluation. So that's what we're trying to achieve by the end of the course. It will be hopefully in a publishable form. And if you know the RaCEEs, for example, you know that the turnaround for publication is relatively quick, and hopefully it will be the same for the RaCEEs. So we will be able to produce an output, a commentary, which we can submit and potentially publish in a relatively quick time. So these are our aims for the course. Now, a quick overview of the content. This is a slide that I'm sure you will already seen before. I'm gonna go through very quickly this slide, and it's just to delineate what we're going to cover in each session. Today, of course, is about research question and selecting an economic evaluation. And the next sessions will give you more and more understanding about the different components of an economic evaluation. And by the end of the course, you will be able, hopefully, to critically appraise an economic evaluation and hopefully produce a publishable commentary. I'm sure you've seen this slide before as well. So just to recap, we have 6 online sessions of 1 hour each. Today, of course, is the first one. The second one will be on Monday the 3rd, and then Monday the 10th, the third one, and then every couple of weeks, the following sessions. These are all online, and then the last one will be face-to-face. So finally, we will have an opportunity to see each other in person at the ArcFest, which will be in Kendal, the Castle Green Hotel in Kendal. But again, we will share more details about that in the coming weeks. Okay, so now I would like each one of you to introduce yourself. As you know, we have 4 teams which will work on 4 economic evaluations. So each team will have their own economic evaluation. By looking at the topic of interest which you selected at the time of registration, we try to allocate each one of you to a team which might be relevant for your interest and for what you want to work on during this course. So in team 1, which is care for vulnerable children and families, we got Will, Farine, Hilary, and Jade. And I think today we got Will with us, yeah? So Will, would you like to introduce yourself and then just tell us where you work, your workplace, but also tell us a bit more about why you signed up for this course and what is your general interest behind registering for this course. Will.
Thanks very much. I'm Will Weston, everyone. Good to meet you all. Medical Services Director at Alderhay Children's Hospital. As I'm sure many of us will be aware that there are great inequities across the region, really, when it comes to the care that children receive and some of the challenges that they encounter on a regular basis. So I'm looking really to see how we can address those inequities, and some of the ways in which we do that will be certainly through understanding health economics better and bringing together business cases which are for the benefit of children and young people. So really keen to learn as much as I can through this course. Thank you.
Oh, thank you, Will. Then I move to team 2. So the topic for team 2 is dementia. And I think we got a good representation today from team 2. So I'll start with Maria. Maria, again, you like to introduce yourself and tell us a bit more why you decided to register for this course.
Yes, thank you, Valerio. And hi, everyone. I'm Maria. I work in the research evidence team of the Alzheimer's Society. And the main purpose of our team is research translation and knowledge mobilization in the area of dementia care. So a big part of what we do is review and critically appraise evidence and advise the organization and make sure our work is evidence-based. So economic evaluations it's really important for my team to understand economic evaluations, because then we can advise on what's cost effective and what can be implementable from that perspective. And this is why I wanted to join this course.
Oh, thank you, Maria. And then we got Terry in team 2. Terry.
Hello there, my name's Terry Bryant. I must confess, I wasn't aware that I'd selected the dementia team, but anyway, it doesn't matter. So what I do, I'm with ARC Northwest, and I'm presently a co-lead on their CHI, which stands Care for Health Informatics side. So I'm a public advisor working with ARC, but I also am involved with a lot of other organizations, both into research and how effectively to deliver particularly mental health care. I do work with the NHS as well. And also I'm involved with the development and rollout of the secure data environment, which is coming online. And all of these, the element of justifying actions on the hard basis, hopefully hard basis, of economics is something which is particularly relevant.
Oh, thank you, Terry. So next we got on team 2, Pat.
Sorry. Yeah. I actually did not realize my name is on dementia. I thought I went for care for vulnerable children and families, but it's okay. That's fine. We're all in it together. So I'm Patricia, and I work with ARC NWC as a public advisor, and I'm also on the MIDAS team as a co-lead. I also work with Lancaster University public advising and public involvement team. And I'm very interested in this because I've actually been working on, I've worked alongside other researchers on the RaCEEs team before, and it would be nice to see it from an economic point of view. So although I did watch the webinar that was held a month ago, honestly, it was a bit of it Chinese to me. So I hope that I will get something out of this course and it will add value to my work.
Oh, thank you, Pat. Of course, we try to allocate each one of you to a team which might be aligned to your topic. But of course, if you feel that you don't want to be in a particular team, just let us know and we can try to switch things around as far as possible. We would like to have 4 people maximum in each team, you know, so just in order not to give you a disservice. So we noticed, for example, with the RaCEEs that more than 4 people is a bit difficult to manage, to be honest. So, but if you feel like you want to be in a particular team, again, like just let us know. That's not a problem at all. And we are going to, you know, we're trying to accommodate as many people as possible in terms of team allocation. Sorry, on team 1, I might have missed Jade. Jade, yeah, because I couldn't see your name on the
Okay.
Zoom. Sorry, Jade. Okay.
Hi, good morning, everybody. I'm Jade Denton. I'm a team manager for family safeguarding across Lancashire, predominantly working central in the Chorley South Ribble area, managing a multi-agency team of social workers, probation, domestic abuse, mental health, serving the children of Lancashire in safeguarding the needs, working from pre-birth all the way to if the care plan ends up to be adoption or over to our long-term care team. And I think similarly to what Will was saying before, it's about those disparities in service provision, working across them all and just having a look and being part of that change in improving services.
Oh, thank you, Jade. Okay, I'll move, I think, to team 3. Hopefully I haven't missed anyone else. Team 3 is about primary care. I think we got Phil McGonigal.
Hi, good morning, everybody. Yeah, my name's Phil McGonigal. Until very recently, I work for Primary Care 24, which is a not-for-profit provider. We operate 12 GP practices across Liverpool and Sefton. We do out of hours and we do 111 as well. And I've moved from being the head of primary care to the head of business relations. We are to try and sort of look for opportunity to rectify some of the health inequalities that we find across Liverpool and Sefton, and it's to do a more sort of economic approach to opportunities that may arise for themselves. So I look forward to learning as much as I can.
Thank you, Phil. We also have Alan Griffiths. If Alan is here, I think it's...
Yeah, hi.
Yeah, hi, Alan.
I've only just this second joined, so I'm afraid I had to go pick somebody up from the Liverpool airport, and the plane was about 20 minutes late. So
we were just introducing ourselves. So basically, yeah, your role in the ARC Northwest Coast and your motivation behind the registering for this course. That's it.
My motivation?
Yes.
Oh gosh, good question. I don't know really. I was at one of the away days, would it be last year? And there was a whole section of people doing nothing else but the RaCEEs. And I didn't join it because I didn't know what it was. And then when this opportunity came along, I thought, oh, right, I should join and see what it's all about.
Okay, hopefully you will enjoy it. That's great.
Yeah.
And then in team 3, we also got, I'm sure I'm going to mispronounce this, Omobolanle, sorry.
Yeah.
Welcome.
Hi, everyone. Yeah, my name is Omobolanle. I work with the Health Innovation Northwest Coast. I work within the evaluation team, and well, the main reason why I registered for the course is because I work within the evaluation team. So we basically work on evaluating pathway changes and innovations in the healthcare sector. So hence why I joined the course. Thanks.
Thank you very much. We also have Trevor Bailey in team 3. So Trevor is not here today, but you will be able to watch the recording on demand. And of course, I'm sure you will be able to meet Trevor later on. Team 4, again, good representation from Team 4. So, team 4 is about social care for vulnerable adults. And we got Sandra Smith.
Hi, yeah, I'm Sandra Smith. I'm a co-lead for the person-centered complex care. I'm interested in healthy economics. I'm also involved with the renal HF project, where I chose to go on the work package for health economics. I have been involved in health economics in the past, and with the NICE guidelines, and realised that nothing's really changed with regard to funding. And so it's about more understanding about health economics for me, but also about for vulnerable adults. I'm actually looking at a project now for end of life for people bypassing A&E. And again, that's going to be about clinical needs, but also about the health economics behind that sort of project. So that's my my main interest in learning more, so I can be more confident in what I say, but also more, what's the word I'm trying to say, stronger in how I present my findings and my ideas to policy changes.
Oh, thank you, Sandra. And then we got Sarah Rockcliffe.
Hi, my name's Sarah Rockcliffe. I'm a senior social worker with Lancaster and Morecambe CMHT. So I'm coming from more of a frontline perspective. I'm working with people with mental health difficulties, supporting people in the community with a lack of resources. It's proved difficult to support the people on our caseloads with lack of resources. I'm very interested in research. I've done a little bit of research work with the Lancaster University, and this is something that just sparked an interest in me, and I'm hoping that I'll gain a lot from it.
Oh, thank you, Sarah. And
Thank
then
you.
we got Rebecca Evans.
Hi guys, I'm really sorry my camera's not working. So I'm Rebecca Evans. I'm a practice development manager in Lancashire, and I work with predominantly work with the exploitation team and contextual safeguarding. I'm really interested in doing research, and actually just feel like I want to make a bit more of a change and a bit more of a difference to the life of people. Predominantly I work in children's social care. However, like, we do touch on the parents that we're working with who might have all kinds of difficulties that we're unable to support them with because we don't have resources. And obviously we need to support those parents to be able to support the children. So I'm here to hopefully make a difference and hopefully learn some things for myself as well.
Thank you very much, Rebecca. Thank you. And it's really good to see to hear about your motivation behind this course. Now, I think, have I missed anyone? Oh, I'm sorry if I have. Okay, that's great. I noticed that you made a point about potentially switching to team 3. Like, of course, if anybody on team 3 wants to go on team 2, so either Trevor, Phil, Alan, or Omobolalle, just we can do that swap if you want. As I say, we try to have 4 people in each team as a maximum, but if anybody in team 3 want to swap with Terry, just feel free to let us know. You don't have to decide now, of course, but let us know if you want to. Now, I'm just going to introduce your team leads now. So, of course, for team 1, which is, again, Will, Farine, Hilary, and Jade, I'm your team lead. So you can contact me by email if you want. But of course, I will be available on the team chat for any problems during the course. Okay, so any queries from like accessing teams or things we will discuss in terms of homework and so on, just feel free to contact me. For team 2, your team lead is Andy Clegg. Andy, would you like to introduce yourself?
Yes, thanks, Valerio. Yeah, I'm Andy Clegg. I work at University of Central Lancashire, and I'm the theme lead for MIDAS as part of the ARC. Thanks.
Thank you, Andy. And again, team 2 is Maria, Terry, at the moment, Katie, and Pat. So just to repeat the team members. Team 3, primary care, is Trevor, Phil, Alan, and Omobolale. So for team 3, your team lead is Luis Philippe. Luis.
Hello all. So my name is Luis Philippe, and I'm a lecturer in health economics based at Lancaster University. And I used to be part of the ARC, and I'm still as an honorary, let's say, member of the ARC. And I'm happy to be here with you. And like Valerio, feel free to send me emails or to write in chat, anything, and I'll try to help to the best of my abilities. Thank you.
Oh, thank you, Luis. And then team 4, which is social care for vulnerable adults, we got, of course, Sandra, Sarah, Jess Iam, and Rebecca. And the team lead is Misael Anaya Montes. Misael.
Hello, good morning. My name is Misael. I work at Lancaster University. I am a senior research associate here. So happy to contribute to this team. Thank you.
Thank you, Misael. And last but not least, we got Zoe Spencer, who is going to shadow me in the management of Team 1. And hopefully by the end of the course, Zoe will be then all trained up and will be able to have his own team for the next run of this RaCEEs course. Joe, would you like to introduce yourself as well?
Thanks, Valerio. Yeah, my name's Joe Spencer. I work at UCLan as part of the impact team in ARC.
Thank you, Joe. Okay, so just before we actually start with today's session, so of course the team's lead now, if you're busy, you're free to leave. I'm not gonna kick you out, but you're free to stay as well. But I know you got a lot of work to do probably, but if you want to go, that's not a problem at all. I just want to also set up the expectation in terms of author's contribution. So as you know, we will try to publish a commentary with you. So each team will publish a commentary, but it's important also that to qualify as a co-author, we try to follow certain rules. These are, for example, criteria which has been selected by the International Committee of Medical Journals editors in order to qualify as a co-author. So it's important we, as a team, recognize these criteria. Of course, we're not going to be very, very strict around these criteria, but it's important we all collaborate, we all work together, and in order to qualify as a co-author for the final commentary. I'm not going to go through these criteria one by one, but they're here for reference, so, for us to keep in mind in terms of our engagement with the course. Okay, session 1. So the aim for session 1 is to identify research questions and select a suitable economic evaluation. I'm going to do a very quick recap around the concept of economic evaluation just in a few minutes. And then I'll move to the actual content of session 1, which is about defining a research question and using the PICO framework. And I will explain what the PICO framework is. Then Cath will very kindly describe how to run a very quick and easy literature search. And then we will talk about selecting a suitable economic evaluation for the RaCEEs. Now, a quick recap of economic evaluation and also health economics in general. You will have seen this slide before, I'm sure. This is a slide which we use to describe the problems we have to face in health economics, or even in economics in general. Luis described this slide during the webinar which we ran last month. As you know, we got some problems in economics around the fact that resources are limited, so we have to make choices. There is a problem of allocating our resources, and when we make choices, we need to be aware of what we are giving up. So we need to be aware of the cost of what we are giving up, but also the potential benefits we are not reaping from giving up a certain alternative. And we have this thing which is called opportunity cost, which we have to have in mind all the time. And if you want to refresh your memory, your understanding around the opportunity cost, feel free to watch the webinar, which is available on the YouTube channel. And you also have the slides from that webinar available on your TeamSpace. If you want, I can resend them to you as well. In terms of health or social care systems, the problems we are facing is making choices against 2 or maybe more alternatives. When I talk about alternatives, I talk about potentially interventions like, medicines, therapies, or more generally treatments. And it's important that we consider the costs and consequences of each alternative together with the costs and consequences of other alternatives we are considering. So it's important we don't see things in isolation. It's important we take into account the costs and consequences of alternative A, and then we weigh them against the costs and consequences of alternative B, and so on and so on. This is the health economic problem which we are facing, and we are facing in a healthcare or social care system. Now, what I would like you to do now is, according to your topic, or the topic of your team, I would like you to take a minute and try to write down a particular research question or even topic you're interested in. So it's important that you think about what is your interest, what is the area of relevance to you, and try to write down a particular research question you're interested in. I'm going to repeat the topics for each team now, and then you can write the research question on the chat, or you can just unmute yourself. You can just say the research question. So the topic for team 1 is care for vulnerable children and families. Topic for team 2 is dementia. Topic for team 3 is primary care. And then for team 4, the topic is social care for vulnerable adults. So just a minute, try to think about a research question you have in mind. Okay. Is anybody very brave? And will you be able to unmute yourself and tell us your research question?
I'm happy to go.
Okay, thank you, Marie.
But my research question is not specific because it would differ depending on the context. But generally what I'm interested in is how cost effective are interventions in dementia care when implemented in a certain context.
Okay.
The context may vary.
That's great. Oh, thank you. Sandra.
Yeah, I've thought about it's the social care for vulnerable adults. I'm looking at staff recruitment, but retention.
Okay. Yes, that's a very good one. Yeah. Thank you, Sandra. Terry?
Okay, well, with regard to the dementia theme, with the population of people who have been identified as experiencing early onset dementia, is there any correlation between that and their diet? Because there's a lot of information coming out now about diet affecting the development of dementia. And comparing, the comparison would be with people who have adopted or lived with a more Mediterranean style diet and those who have not, and to evaluate the development of early onset Alzheimer's, trying to correlate that with a particular diet.
Okay, very interesting. That's very good. Thank you, Terry. Alan?
Yeah, mine's primary care. And my question is a really, really, really basic one. A few years ago, we had one GP and you could get an appointment within 2 days. We now have, in the same practice, 4 GPs. The number of patients is pretty much the same as it was before. It now takes 2 weeks to get an appointment. Why?
I hope I could have the answer. Okay, that's very good. Oh, thank you, Alan. Oh, we got another one. Omobolalle.
My question, based on primary care is treatment of acute respiratory infections in primary care more effective and lead to better outcome for patients compared to secondary care?
Very good. Oh, thank you. Thank you very much for sharing that. And Phil.
Yeah, mine's quite a simple one as well. Is there was a move some years ago to GPs to AMPs because they were deemed to be a cheaper resource or whatever. But do AMPs provide value for money in a primary care setting?
Oh, okay, that's very good. Oh, thank you as well for that. Okay, I'll move on, and this is just one of possible research questions you can think of. For example, is a physical exercise program cost effective in improving balance for patients with stroke? Okay, so this is a research question you can think of, and what I'm going to ask you to do at home, like when we finish this session, is try to break down the components of your research question into different in different elements, really, and try to think about this framework, which is the PICO framework. PICO stands for population, intervention, comparison, and outcome. So if you take the research question you see there on the screen as an example, and if you look at the first row, just the first row for now of the table, what we've done there is try to break down that research question in different components. For example, the population. The population is, of course, adults with stroke. That's the people we are trying to take care of with this particular research question. Intervention is the physical exercise program. Comparison, we don't have really any comparison in this research question, but we can think about, for example, usual care in case, or any other comparator. The outcome is going to be balance. Of course, we are trying to measure the effectiveness of the intervention by looking at balance. So that's your outcome. Now, as part of your homework, you will have to think about a particular research question you got in mind, and then try to search articles which are focused on that research question. And to search for articles, it's important to outline some search terms and to try to think about search terms. So in the same way you go on Google, and when you're looking for something, you will use possibly similar terms to the one you got in mind. Here we are trying to do pretty much the same. So when you think about stroke, of course, another term which might be related to stroke is cerebrovascular disease. When you think about physical exercise, you can think about physical activity, exercise. For comparators, we don't have any comparators, so we don't need to think about any search term. For outcome, of course, balance, mobility, other similar terms can be used here. So first of all, this is kind of the reasoning we have to put in place in a way. Just think about similar terms and try to build a search around those terms. But now, how to put together a search string, this is something that Cath will talk about, so I'm just going to leave the stage to Cath. I'm going to stop sharing for now. Cath.
Thank you, Valerio. I'll just get the slides back up. Has that worked? Can everyone see the screen? Yep. Can everyone see those? Is that okay, Valerio?
Sorry, I forgot to unmute myself. Yes, it's good, yeah.
Brilliant. Okay, so so we have, as Valerio says, we've thought about some search terms that we might use. Now we need to into a search string. So for each of our concepts, for each element of our PICO, we have a cluster of terms, and it's a bit like a maths equation. We'll need to put those within brackets so that the database executes the search correctly. So I should say here that there is more than one way to do a search on most database platforms. There are more advanced techniques But for today, just to do something quite simple, we're just going to do one search string. So we just need to use brackets to tell the database to sort of search for the groups of terms together. So in between each of our PICO concepts, our PICO cluster of terms, we need to use and then in between the individual terms, so stroke or cerebrovascular disease, we need to use OR. So these are known as Boolean operators, but that's really just a fancy term for the instructions that you give the database to tell it how to execute your search. So OR tells the database to search for either or any of the search terms. So that will retrieve abstracts which have either of the terms that you search for. So OR is more, or will return more results and make your search more broad, and tells the database to search for all of the search terms or both of the search terms. Will retrieve abstracts that have both of the search terms within the abstract. And the more ands you have in a search, the more focused your search will be and the fewer results it will return. We can also use quotation marks where we want to search. If we have a term that has more than one word in it and we want to search for that as an exact phrase, for example, here, chronic obstructive pulmonary disease, if we put quotation marks around it, it will tell the database to search for that as an exact phrase. If we don't use the quotation marks, normally most databases will default to AND, so you will still retrieve the relevant results, but you might also retrieve a lot of irrelevant results because it will search for the terms anywhere within the abstract, not together as a phrase. So if we have a look at what it will look like in a search string, so we will have our population terms in brackets, stroke or cerebrovascular disease, because you want either of those terms. Then we'll have our AND operator, then our intervention terms, which are physical activity or exercise, and our outcome terms, which are balance or mobility. We then have some terms for economic evaluations. So we have and cost or price or expenditure or expense, and economic evaluation or cost effectiveness. So these last two concepts within the search, that's going to filter out, hopefully filter out many of the results which are not related to economic evaluations. So it's going to focus our search to the study type that we want to look for, which is cost and economic evaluation. So today we're going to have a look at searching on PubMed. So there is a link here on the slide to PubMed, or you can just Google PubMed and you'll find it. PubMed is a database platform which is produced by the National Library of Medicine in the US. It's freely available, it's completely open access, so everybody can get access to this on the internet. PubMed comprises of the Medline database, so that is probably the main health sciences database that we use, and it also has some extra content, some life sciences journals and online books. So it's a good general database which can be used for most health and social care topics. And if you're working, for example, I know quite a few people here are working for the NHS, you'll have access to other databases, so you'll be able to use your search string in those databases if you want to try some different databases as well. But this is a good one because it's accessible to everyone. So we can just have a look at that. So can everyone still see my screen? Yeah, good. So this is the homepage of PubMed. So as I say, there are more advanced ways to search, but for today we're just going to search for a simple search string. So we're just going to use the search box on the homepage. So I'm going to open my brackets and I'm going to search for my population terms, which are stroke or cerebrovascular disease. Cerebrovascular disease in quotation marks, because we want that as a phrase. Then we're going to close the brackets and we're going to put an and to combine it with our next concept, which is our intervention. So that's physical activity or exercise. I'm going to close the brackets because those are our terms for our intervention. Another AND operator, and then we've got our outcome terms, which is balance or mobility. And then our terms for economics. So we've got cost or price or expense or expenditure. And then we've got our study type, which is economic evaluation or cost effectiveness. Again, all in brackets. So we've typed in our search string, just check that we haven't got any spelling mistakes, and then we're going to click on search, and that will run the search across PubMed. And there we have 41 results, so that's not too bad, not too many results to have a quick look through. We've also got on the left-hand side of the screen, we've got some filters that we could use if we wanted to try and narrow down the search. Particularly, we will recommend that you try and find a study that has been done in the last 5 years, it's been published in the last 5 years, because we need something that's quite recent, so we can narrow this down to the publication year, last 5 years by clicking on last 5 years. And there we have, that's reduced the number of results to 17. So we can have a look through some of these results now, and just got in the results screen the titles and a brief part of the abstract. So you can have a look and see if any of the titles appeal to us. If anything looks promising, we can click on the title, and that will bring up the full abstract. So the abstract is a summary of the paper that gives you kind of the main methods and findings. And then if we read the abstract, we think, yes, this sounds promising, this sounds something that we would be interested in. Links to the full text appear just to the right here. So this particular paper is open access, that means it's free to access. So we can click on that link, there's one of those links, and it will take us to the full text PDF of that paper. It might be some papers require a subscription to access, not freely accessible. Some of you, if you're working for an institution like the NHS, will have access to lots of journal subscriptions through your Open Athens accounts. So you may be able to get access through your organisational subscriptions. If you're a public advisor or you're struggling to get access to anything, if you just contact us, we'll do our best to help you get access. Just one more thing to show you, which is quite helpful. In PubMed, underneath the abstract, there is a list of similar articles. So these are articles that PubMed thinks are quite similar to this article, and that can be quite useful. So if you find a paper that's not quite right, but's on the right lines, you could have another bit of a look through these similar articles, and it might return something that's of relevance. So it's another way to sort of explore the literature and to find some relevant papers. Just go back now to the slides, okay. So it might be the first time you do your search, you might need to refine it a bit, and you might find that you're finding far too many results, you're finding unmanageable numbers of papers. We'd say if you find more than about 100, you might want to add another concept to your search. So for example, if you searched for population and intervention, you might want to add some terms for outcomes to your search, or if you're looking at a specific comparator, for example, if you were looking at 2 different types of exercise, yoga versus aerobics, you might want to have terms for your comparator as well. As I said before, the more ands you have in a search, the more narrow your search will be. You might need to take out some of your synonyms, your alternative terms for your concepts. So if you've got a lot of different synonyms, for example, for your population, you could take some of those out to make it more specific and just stick to kind of the key terms for your topic. If you are finding that you have too few results, you can't find any relevant papers, you might need to remove one of the concepts. So if you are searching for population, intervention and outcome, you could try taking out the search terms for the outcome and just search for population and intervention, and that will broaden your search. You might add in some synonyms for the concepts. So try adding in some different terms. For example, for stroke, you might search for terms like ischemic, hemorrhage or ischemic. However, it might be that there just isn't an economic evaluation that has been done on your topic. If you're looking for something very specific, it just might be the case that nothing's been published in the last 5 years on that topic. So you might need to think about a slightly different research question and maybe redefining your search question a little bit. So just finally, as an example of how you might develop a search, a literature search, for example, we tried this simple search string of stroke and physical activity. This returned 4,595 results, which is definitely too many. So then we tried to add in the outcome to the search string. So we had stroke and physical activity and balance. This dramatically reduced the number of results, and we found 281 results. However, these results will include clinical research as well as economic research. And as we're specifically interested in economic evaluations, we wanted to refine our search string. So we did the full search string that we did before to refine the results to just the study type. And as we saw, that returned 41 results, which was not too bad. Okay, does anyone have any questions at this point about searching?
There was thanks, Cath, first of all. And there was a very quick question, I think, from Terry. You know, the and or do they need to be in capitals? I think so, isn't it? Yeah. Okay.
They don't actually. On most
Okay.
databases, they don't need to be in capitals. Yeah, you can use lowercase.
Okay, that's fine.
Just for the example, we have capitals, but yeah, most databases will recognize either if you're using capitals or non-capitals.
It's good I checked with you then. That's good. Okay, thank you. Any other questions for Cath?
Sorry, I'm not sure how to raise my hand on Zoom because I usually use Teams, so bear with me. I just wanted to ask you if you could provide us throughout the course with a list of search terms that are related to economic evaluation.
I think we can, no, Cath. We got like one we usually employ, isn't it, to run our searches?
Yeah. I think for the purposes of doing a simple search, the search terms that we've used today, that we've, you know, economic evaluation or cost effectiveness will probably be enough. There are bigger search strategies that are more sensitive, that will return more results, that we use when we're doing a systematic review, that are available. So we can, you know, if you want to have a look at some of those, we can put some links to some different options as well. Yeah, that's fine.
That would be helpful. Thank you.
Thank you. I would say very simple way, I guess, to identify an economic evaluation. Usually you got that in the title. So if you say economic evaluation in the title, or cost effectiveness analysis, and you know, usually it's a very good clue. Not everything that is economic related is going to be an economic evaluation. So just be aware of that. But if you have economic evaluation in the title, I would say there's a really good clue there. Any other questions for Cath? Okay.
Okay, I will stop sharing them.
Thank you very much, Cath. I'm going to reshare my screen. Just 1 second. Here we go. Presentation mode. Okay. Hopefully you are able to see the screen. Yeah. Okay. So just to conclude, we go. The next step, so as Cath was mentioning, is to read through the abstract of the results, see which one is the most relevant for you, if available. As again, as Cath was mentioning, you may also want to look at the full test to get more info. But also try, if you want to, try to use this table and try to use this criteria to help your selection. Okay, so these are criteria which you can use as guidance. You know, you can try to see whether the article really has got all these criteria or not. You don't have to have 5 yeses. I mean, if he's got 4 yeses, it's already a good result. That's fine. But try to consider this criteria in your selection. So if the economic evaluation is relevant to your research question, if the economic evaluation has a clear focus, if the economic evaluation is easy to understand, that's really good. Actually, this is probably one of the maybe the main criterion we need to follow. And also check the abstract to see if the authors conclude the findings are relevant, or, for example, if they're applicable to practice. And another thing that Cath was mentioning, check whether it's been published in the last 5 years, and you saw that we can use filters in order to select recent articles. Sandra.
Hi, yeah, on the this PubMed, when you say you have it up and it says you can select, I've got it on my laptop at the moment, it says you get your find related data and it says select, and there's various selections, so things like books, gene, geo profiles. What's all that about? Pub, chem, compound, what's all that?
Oh, okay. You know what, Cassandra, maybe it's better if at the end of the session you share your screen and you show us what you can see.
Okay.
I will be able to make your calls, and then we can go through that question with you. I'm sure Cath and I will be able to answer that.
Okay.
Okay.
Yeah.
Sorry,
okay.
I can't answer very
No
quickly.
problem.
Oh, yeah.
No problem. Thank you.
Thank you. Okay. Now, homework. So you got 3 tasks after this session. The first task is each one of you to search and select a suitable economic evaluation based on your theme topic on PubMed. So following the guidance that Cath gave you a few minutes ago. And then once you find an economic evaluation which is relevant to your interests, write it down, write down the title, and copy and paste the link on this Word document, which you can find Teams, and I will show you the screenshot in a second. And we are going to ask you to complete these 2 tasks by next Monday. Of course, you know, we are not a school, so we're trying to be flexible, but we will remind you, okay? So you got a week time to do these 2 tasks. On Teams, you will find the document I'm talking about. If you click on session 1, the folder for session 1, and then you will see this Word document called session 1 homework. Of course, this is related to team 1, but each team will have its own document. Then once you open that document, you can then write the title of economic evaluation under your name, and then you can copy and paste the web link to the article as well. Okay, so you will find your name and you will find the space to write the title and copy and paste the link to the article. So these are the first 2 tasks by next Monday. Task number 3, then you can have a look at the economic evaluation selected by your teammates, okay? And then indicate which one you prefer on the Teams chat. So you are, for example, in team 1, you can see the economic evaluation selected by your other 3 teammates, and then just select the one you prefer on the Teams chat. But it's important you don't vote for your own. It's a bit like Eurovision. You can't vote for the song from your own country. Just try to vote for another person economic evaluation. Hopefully there will be a preferred one, and that will be the economic evaluation you will work on during the course. And please try to complete this task by Friday the 24th. That's it. And then the team lead will double check the economic evaluation you selected. So I will double check the economic evaluation for team 1, Andy for team 2, Luis for team 3, and then Michelle for team 4. Why do we do this? Because it's important we work on a good economic evaluation. Like if it's terrible, you don't want to work on something terrible for 2-3 months, do you? So it's important that we, the team leads, check the economic evaluation, make sure that it's a good one, and it's also like relevant in terms of informing change in policy and practice. So we will try to just to make a check around that. But of course, the collective is a collective choice at the end of the day. That's it. I think we're finishing on time. Yes. So if you have any question, I know Sandra's got a question, but if you have any question on this session, you of course, we are happy to stay for another 5 minutes or so, but you can also write us on the Teams chat and by email, and we are available to answer any questions you might have. I'm just I'm gonna stop sharing for now. Do you have any question for now? Very quick one. We got a couple of minutes. Or otherwise, I just want to thank again for coming to this first session. I hope you enjoy it. If you have any problems in terms of the homework, we are there. You know, the team's leads are there, so feel free to contact your team lead. We will share the slide, the recording, hopefully very soon. But I really thank you for coming in, and we will see you on Monday, the 3rd of June for session number 2, okay? And we will send you a reminder, of course. Thank you very much, everyone, and it's very good to see you all today. Thank you.
Thank you.
Bye-bye.
Thank you.
Bye.